if I'd like Westborough TV, if you can start recording. Welcome to the Board of Health meeting for January 31st. Pursuant to Chapter 20 of the Acts of 2021, this meeting will be conducted via remote means in accordance with applicable law. This means that members of the public body, as well as members of the public, may access this meeting via virtual means. The meeting may be accessed remotely via Zoom as posted. When required by law or allowed by the chair, persons wishing to provide public comment or otherwise participate in the meeting may do so. Additionally, the meeting will be broadcast live in real time via Westborough TV on local cable, Verizon channels 28 and Charter 192, and their online platforms, westboroughTV.org and youtube.com/Westborough TV. We're going to wait just maybe one more minute until Dr. Ehrlich arrives. Otherwise, we will get started without him and let him pick up as he joins in.
He'll be on momentarily.
Thank you. And for those joining but not speaking, I ask that you please put your microphones on mute so that we can limit distractions. And also, if you can, if you're just a member of the public and not actively taking a turn speaking, I ask that you turn your camera to a still picture so that it also is not distracting. Well, Dr. Mayer, I've got some introductory slides. I don't know if you have any introductory things that you'd like to read. We can certainly start with some of that if we wanted, but
yeah, we can start with your slides. Thank you.
Okay. And we probably will end up having to re-show them once Dr. Ehrlich joins us. But is it possible for me to become a presenter? We can certainly do it without slides. So some of the biggest trends that we've been seeing over the past few weeks has been that starting in December, we've started to have a large increase in the number of cases. It does seem like in many areas we've kind of peaked and they've started to drop. And so we're still much higher than we have been in the past, although it's heading in the right direction. And the reason for obviously the meeting today is that we're trying to decide whether to, looks like Dr. Ehrlich is now joining. Good. Welcome, Dr. Ehrlich.
Hello, sorry for being late.
That's all right. We've started the meeting and read the preamble, and we were just trying to start to do the kind of recap of the state of where we are right now. You may have some stuff that you'd like to comment on, but if not, I've got just a couple of things that I was going to mention.
Why don't you just go ahead and get started?
Okay, so the
Excuse
yeah.
me. I've got you set up now.
Oh, okay.
Okay,
Right.
this guys.
Good. Can you see those? So this is basically the Massachusetts hospitalizations, and you can see that we've had kind of peaks in each of the prior times, last winter in particular in the middle here, and then again right now. And one of the takeaways is that even though this trend is starting to drop, we're still high, and so we're headed in the right direction, but we're certainly not at where we were over the summer. And in town in Westborough, if we look at our cases, the past 2 years in orange and blue, you can see that we were pretty low during the summers in the middle, and in the winters, kind of at the edges of the screen, it's have different peaks. If you look at the peak that we've had in 2022, it's significantly higher than the peak that we had in 2021. But again, the trend is dropping, and you can see that this dropping seems to happen a little bit earlier than the hospitalizations, which is good. I think that would imply that our hospitalizations are likely to come down too. But we're still higher than we've been in any of the past 2 years. So that's concerning in and of itself, that even though we're heading in the right direction, I think it implies that we're not quite there yet. So that's what I was thinking of for kind of a quick recap on where we are. Obviously, I'm interested in hearing, though, what Dr. Ehrlich and Dr. Mayer, what you guys have. You guys are a little bit more in the healthcare field, so you might have a little bit of better understanding as to where we are.
Sure. So, I mean, I think your statistics, are the data is the data there. My experience over the past, say, 2 weeks has been that there has been a noticeable decline in patients coming in with COVID compared to several weeks prior to that, and that decline has been quite noticeable. Obviously there's still plenty of patients with COVID around, and that the hospitals, while they still have plenty of patients, the sense of we have to cancel elective procedures and things like that has abated. Again, I agree with what you're saying, that we're moving in the right direction. I also agree that the numbers are still quite elevated compared to other times in the pandemic, particularly around the case counts. The hospitalization, depending upon what you look at, some things are getting better. There's certainly early on in the pandemic when we were opening field hospitals, we're certainly nowhere near doing that kind of stuff.
Actually, geographic, though, you can't log in and stuff.
What else is geographic?
I'd ask that whoever is not muted, please mute if you're not part of the meeting. Dr. Mary, did you have anything you'd like to add?
Sure. Like you mentioned, we're still at, it's great that Massachusetts cases are less than 10,000 a day at this point, but still, of course, that is very high. As you said, hospitalizations are now slowly decreasing, but still, as of Friday, you mentioned over 2,300 people hospitalized. And in the past 2 weeks, 194 children from age 0 to 18 admitted to the hospital, just of note. We're definitely seeing, high numbers of these cases in children and adults. And in Westborough, as you mentioned, we had 174 cases, if we're including the 9 called in rapids, which is still considered a very high transmission in Westborough in Massachusetts. And in Westborough in, let's see, 19.7% test positivity, also considered high transmission. So, it's great that the numbers are coming down. It's great that the hospitalizations are following, coming down, but we're still at high levels. I agree.
And so I wanted to comment on some of the emails that we've been getting, because we do read those. And I think that we had maybe misspoken a little bit at a meeting where we basically said that because we haven't heard anything, that means that, there were no problems. I think that was how some people interpreted the comments. That is not necessarily the case. We are not a board that reacts to votes in the sense of, if more people want something, we just go and do that. We do try to focus the science. And so just so that people are aware, one well-written email to the Board of Health actually carries more weight than having 10 people send the same exact letter into the Board of Health. It just takes us 10 times as long to read each of the emails that people send in that are identical. Whereas, one well-written email from, one representative of a group with a similar idea is actually easier for us to respond to and digest internally. So I do want to thank people for writing in, though. I think that every week there are some unique stories or opinions that we hadn't quite heard. And so it's nice for us to be aware of how masking in town is affecting people and making people feel. But it is important that, we make decisions based on science. Let's see, I think, Jennifer, you wanted to introduce the nurse, and Ellen, were you about to say something?
Yeah, I wanted to make a few more comments about the emails we received, if that's okay. Please. At this time. Yeah. So I'm going to second what you say about, yes, we read every single one, and that our decision is not based just on the number of people writing in one way or the other, but the perspectives that are shared do influence our discussion as we try to address the points that people bring up. One of the things that was in a common theme in some of the emails was that the mask mandate allegedly was in response to the school board's flexible masking decision. I don't think that's correct. At the meeting that followed that school board decision, we adopted an advisory, and it was not until the hospitalization counts were very high in January that we adopted the mandate. So I don't think there's a connection between that. We also included an expiration date that was independent of any school board decision. So I wanted to make that point. A few other people mentioned that because there's a lack of a state of emergency, that affects our ability to enact a mandate, or that perhaps we've exceeded our authority. And both of these statements are incorrect. We always have the ability to have regulations that are additional to what the state requires, whether that be for food safety or anything else related to public health. A couple of years ago, we had a problem with Eastern equine encephalitis. We banned outdoor activities in town fields. That was certainly within our scope. And if you look at other towns in Massachusetts, some of boards of health adopt more stringent regulations, not just now, but even at various points during the pandemic. So I just want to make clear, we have the authority. You can say that perhaps we're not using it wisely. That'd be, that's an individual judgment, but this is within what the Board of Health is authorized to do. And then finally, there's sort of two extremes that get presented. One, which is that masking has no evidence to support it. Another is that it's the best way to prevent transmission. And I think probably both of these are not really accurate. There is some evidence, and we can discuss the quality of that evidence in favor of masking, but there are also other factors that are at least as important or more important. So those were just responses I had, and if anyone else does as well, just to some of the feedback that was sent in. I see there's stuff in the chat, and I'm not sure, Nathan, how you want the chat dealt with. Yeah.
Yeah, my feeling is that, this is to respond to everybody in real time. I think just encourages everybody to send in lots and lots of stuff in real time and actually disturbs the meeting. If people want to write out a well thought out answer, I'd prefer that they send it in by email and we can digest it and make sure that we're responding appropriately to that. So I would tend not to handle the chat live during the meeting.
Okay.
Obviously, if something comes up that you think really does need to be addressed, you're welcome to chime in, but I wouldn't necessarily have that be part of the meeting.
Okay.
So with that, maybe Jen, you can introduce the nurse and the topic here.
Sure. Jim Fedderson is our public health nurse through the Greater Boroughs Health grant that we received. And he's been fantastic. He's doing about 15 hours a week with us. And he's been working on cases and also creating a senior program that we're hoping to implement by spring. So Jim, if you will, tell him a little bit about yourself.
Frederick. I am a full-time firefighter paramedic for the town of Hopkinton. I'm also a BSN nursing from Worcester State. I've been a nurse for about 6 years now. I was an ER nurse for quite a while, getting a little older, so I'm starting to slow down a little bit and decide to focus more on public health and trying to assist in the best I can.
Well, thank you, Jim. I appreciate it. I think all the help we get is, important and useful, and especially with us, not having dedicated nursing staff as part of the Board of Health. It's important that, this opportunity to kind of work with the different other towns around us be there. So thank you.
You're welcome.
So I think we can get to the meat of the topic that we wanted to address today, and that is a look at the masking mandate that we have in place. We had set an expiration date for the end of the month, and I think that some of the people that did write in to follow up a little bit on what Alan had said, have asked a couple of things. One is that if we're looking at putting in mandates, that we constantly review them, that we don't have them just last forever. And so I think that this is part of exactly what we are doing right now, which is to make sure that because we have a mask mandate in place, that we do look at it. The other thing that came up in the emails that was probably an oversight on my part was how much notice we need to give people. And it was well said in one of the emails that came in that giving people more notice on putting in mandates is more important than giving people lots of notice on taking them down. I think they had said very succinctly that to get rid of a mandate, all they have to do is pull the sign down from their store window. And if people want to keep wearing masks or don't want to wear masks, then it becomes a very easy policy. But the reverse of putting in a mandate and requiring the printing of signs and putting them up and then explaining to all of the customers in the areas in town that need it, it's more work on the mandates going in. So with that, makes perfect sense. And again, I would, I think last time I had suggested that we give a fairly lengthy period when we're reviewing things to have it cancel. And I want to just say that now I agree with some of the logic behind what was said, and that pulling down mandates quickly does not present a problem when the time is right to pull them down. So my feeling on the mandate that we have in place right now is that while it's very hard to tell what the specific effect of the mandate is, we certainly don't see it at the hospitalization level of Worcester, but I do think that it is helpful. I do think that it is helping to prevent cases, especially in this period where we have a high number of cases coming in every day. I do think that the time that we want this still enforced, though, for me, looks to be rapidly ending, but not quite yet. So I'd be in favor of kind of continuing it, but for maybe only a couple of weeks. But I'd love to hear what the other members of the board are thinking, so that we can kind of come to a little bit of a consensus.
I agree with you, Nathan. I think it's I think I would continue the mask mandate for at least a couple more weeks as we hopefully see the numbers continue to go down. There's definite data showing that mask mandates and masking help reduce transmission, help reduce deaths. I'm happy to share this information. And I think it's important for people in our town to feel safe when they're out and about doing the things they need to do, whether it's shopping or, going and having this layer of mitigation, having this mask mandate, I think helps people do what they need to do in our town and feel safe when doing it. So yes, I am also in favor of keeping it on for a few more weeks.
And what are your thoughts, Dr. Early?
So my preference would be that we go back to what we had in December, which was an advisory. If you look at the hospitalization rates right now, they're not that different than they were in December. And my concern about the mandate is that there seems to be, in my estimation, a lack of consistent support for this, not just within the feedback that we've gotten through the various emails and whatnot, but if you are, look at public health officials as well as various media outlets across the country, there's a wider spectrum of opinions being voiced about the efficacy of masks. And in that environment, I feel like it's not clear to me that mandating masks at this time is the best public health approach. That the problem with mandates is you get, as we know, people need to have confidence in the decisions that the Board of Health makes. And to the extent that we don't have the support of the public in the decisions and the direction that we're going, I feel like it undermines our ability to handle future problems. So in the long run, I worry about what the effect is of policies that, if for better or worse at the moment, are clearly somewhat divisive, and I'm trying to avoid that. And I think with an advisory, it would communicate what we consider to be good practice, but it doesn't quite have the tension that the mandate does. And I think you'd find most people are wearing masks anyhow in town, in public places. The one thing I will say is part of the problem with the mask mandates as they've been viewed, at this point in time, is some of the inconsistencies that people have pointed out. And so you have restaurants where people wear masks for a few minutes of the very small percentage of the time they're in a restaurant, and I don't think we're considering stopping gatherings or closing restaurants, and yet we sort of ignore that piece of it by the policies that are in place. If masking is that important in all public places, then why are we allowing restaurants to operate in the way that they do? And which I'm in favor of allowing them to do that. But I mean, these questions get asked, and this is what undermines the public's support for universal mask mandates.
No, I think that's a very good point, and that a lot of people have kind of pointed that out. And in the past, there have been, restaurant bans, special, procedures to make sure tables were, each parties were, 6 feet apart. We had plexiglass barriers between them. We have had some of those mitigations in place when we, didn't have control of the situation. And so those are things that, the Board of Health has considered in the past that we've, would be one extra layer of mitigation strategies we could put into place. The other aspect that we've, heard a lot from are people that have said that they don't enjoy going to, restaurants or businesses in town because of the mask mandate, and that they are spending their dollars, in other towns that, don't have those. Now, people that want to engage in risky behavior and want to go outside of Westborough to engage in risky behavior, I mean, is obviously something that we're not talking about preventing them from doing. but just because they want to and can do that doesn't necessarily mean that we should make our businesses in town riskier. Now, I think that we want to balance the level of risk with the level of inconvenience and, move toward the option of personal choice. I think that that's obviously where we want to be. I am concerned, though, that the cases are still high, and having some extra layers of mitigation are important. I don't think we need to go as far as, closing restaurants or something like that. I see this as a kind of a continuum, and we need more strategies in place when things get really bad and we don't have control of the situation. I'd say that right now, with cases dropping, we want to be working in the direction of, starting to roll back some of these restrictions. So I think that I'm looking at the same data that you are, Alan, but coming to a slightly different conclusion as to where we are right now. But I do think that if they keep heading in this direction, I think that we may end up being on the same page in the very near term. Dr. Mayer, I think you were about to say something when I jumped in and cut you off.
Sure. So I'm not sure we can say, Dr. Ehrlich, that we don't have support from the majority of businesses in our town. I mean, we haven't taken control of businesses. I think in general there has been strong support from certainly people that I've to. Yes, there are some vocal places or people that have not supported it. So I think it's hard to say without really taking a poll or asking all businesses or asking all community residents without saying that.
So the basis
and saying that we don't
Okay.
have support, that's something I would have to disagree with.
Okay. The basis for my comment is at least my perception, both in personal conversations, in what I read in media, and what is sent into the Board of Health, that there seems to be a broader range of perspectives on masking and obviously some of the frustrations around masking than at least I noted, say, 2 or 3 months ago. So you find things in the Atlantic Monthly or other major publications that are saying, the evidence is mixed. There's definitely evidence supports masks. There's other evidence that says, yeah, but the net effect is small. And so, you take all that into account and say, well, okay, what is the downside to not even the mask? It's what's the downside to the mandate. And to me, the downside to the mandate is the public trust and the public cooperation that I think is important to maintain going forward.
I do, we do see mask mandates continuing in surrounding towns, Northborough, Southborough, Shrewsbury, Worcester, Grafton, Natick, Framingham, many towns. I don't know. I've been looking, and Jen, you can correct me if any of them have an endpoint that they have decided upon. It certainly isn't something, we're going without, precedent with other towns doing it. Other towns have very similar rules that we have. So.
Yeah, and I think, Dr. Ehrlich, your point about, the public trust is very important. Our role as members of the Board of Health are to kind of look at the data, look at the science, come up with good policy, and implement good policy. And, in the history of the Board of Health here in Westborough, we've, tried to do that very consistently. Looking back at some of our history, when we put in certain cigarette smoking mandates in town, we were actually one of the first towns in Massachusetts to, put in some of the cigarette bans in public places, indoor spaces, that sort of thing. And there was a lot of vocal, people that were very much against it, saying it was a personal choice. If people don't want to smoke, they don't have to, or if they don't want to be in a building with other people that are smoking, they don't have to. in many ways, what we're doing here is trying to figure out how best to accommodate everybody's rights with everybody's safety. And, we're looking at the data, we're trying to make a decision. We do think that in the height of a pandemic, it's very different than when we're not in the height of the pandemic. But right now, with both hospitalizations and in number of cases of COVID-19, we are in the highest peak than we have been in the past 2 years. So I think that, all of 2020, all of 2021 was not as bad as it is right now. So I think that we're moving in the right direction. I'm hopeful that if the rate at which it's dropping continues to drop at this rate, within a couple of weeks, I think that we'll, be in a spot where I'd be comfortable, making it still be a recommendation from the board, but not having it be a requirement. If the rate at which it drops slows and we end up kind of just plateauing really high, then, we might have this last longer. To those people, though, I think that one of the biggest things about the public trust that we have is that there are some people that continue to send in emails saying that masks are completely useless and that they don't form, any basis for, scientific policy. And I think that's probably where we've got the biggest gap between the public trust and the Board of Health, is that I've gone in, I've read all of the original references that people have sent in. I've also done a fair bit of research on my own. I am quite convinced that masks do help, and not that they prevent 100% of cases, but that they improve the odds at which the virus will be transmitted, and both as source control and in terms of protecting oneself. I think that there's data to support that. And so I think that for me is one of the biggest obstacles we have in terms of where people are coming from. Obviously, if we were to put a mandate in place with something that had no effect, that would certainly erode public trust.
So on that point, though, Nathan, there's two things. It's easy to say that it improves the risk of transmission in terms of more favorable risk outcomes. But unless you're putting a magnitude on that, it becomes somewhat, vague. And then the second thing is when you talk about, the effectiveness of the masks, we know that the N95s are the most effective, surgical masks somewhat less so, and then the cloth masks even less so. And we discussed this at the last meeting, and we decided we weren't going to mandate a particular kind of mask, but at some level we've received pushback on that because the cloth masks aren't particularly effective, and yet we consider them acceptable to meet the requirement.
Yeah, so I mean, there is a difference between not as effective and not effective. And so there are some people that are having trouble grasping that difference. And I do think that there's a difference there. I do think that having a mask that fits is also super important, and in terms of not letting air leak out the sides or the top of your mask. And I think that that's another factor that comes into play. Mandating that is that you have a properly fitted mask is hard. At a hospital, you can train your staff members on how to fit a mask, and you can have them get trained regularly to make sure that they're wearing their masks properly. That's certainly a lot harder when you're talking about the general public. So I think there we can give guidance, but I'm not sure that we can require that they'll be trained on how to use a N95 respirator. I would love it if everybody, took the time to go look up on the CDC how to properly fit a, N95 respirator, and they wore those. I think that would help even more than, having a mask mandate if everybody just optionally went on and figured out how to use them properly and did that. But I'm not sure that that's reasonable.
I'm sorry, Nathan.
Oh, go ahead.
So, to follow up on what you were saying, Alan, the CDC, Rochelle Walensky did just come out and make the statement, I think it was last week, about, the various types of masks. And, they did not come out and say everyone should wear an N95. They certainly came out and said people should be indoor masking, whichever mask they keep on indoors as long as they can, the best fitting. So certainly, there is data showing that, the N95s may be best with, however, they are not coming out. No one is coming out and saying that we need to do away with all other masks either. But it,
Can I state something or give a reminder?
Yep.
So during contact tracing, about 90 to 95% of people we spoke to knew who they contracted it from. It wasn't in a public place. It was somebody they knew. Very rarely you'd come across that person who didn't understand where they contracted the virus. And also, I know you're going by state numbers. They're also behind current numbers. And next week, our numbers and the state numbers should be very low because students will be testing and doing their at-home testing. So our numbers are not going to be accurate at all. And also, this week, since Thursday, we've only had 32 cases. We haven't had any more today at all. So the numbers are declining rapidly. And I'm just not thinking you're seeing, I'm thinking you're not seeing that currently because of this, you're looking at the state numbers, which is I completely understand. And also on the public health aspect in office, we're not seeing that urgency at hospitals either, which was the number one reason you did reference this or create this mask mandate. So I just wanted to bring those topics for you to think about before you vote. And if you do choose to make this mandate continue, I ask that you vote or review it weekly rather than in 2 weeks, because I do think the numbers will follow quicker than the need to make it a 2-week wait time to remove.
Yeah, so I just brought up on the screen the Westborough cases. And so while we don't have hospitalizations for Westborough because they don't necessarily get reported back to us, we do have the number of new cases. And so this is the number that you're saying, is dropping rapidly. And certainly we've seen in the past, 2 weeks that it has dropped from the peak to where it is now. How fast it continues to drop, if it is really dropping as fast as you say, then maybe it does make sense to revisit this in a week. But at this point, I think that we are still higher than we have ever been in the past 2 years. We're still in this peak that's, this winter peak here. And I'd really like to get that lower than where it is now. Is there more discussion about this, or have we kind of flushed out where we are and heard each other's opinions?
There is one thing, again, this highlights where some of the uncertainty is, but I believe what is our mandate for those 2 and older, more or less?
Yes, I believe that's the case.
Because I had the impression that the World Health Organization was not in favor of masking kids under 5 as a rule. And I didn't know if that was something where, again, you've got the CDC is in favor of it. World Health Organization says not so much. And this is an area where it sounds like, okay, what's the net benefit in that age group? I didn't know if we want to discuss that at all.
Yeah, I don't know. Sorry, go ahead, Dr. Yeah.
No, go ahead.
No, I was just going to ask Jen if she kind of knew that age breakdown. I don't have any of those numbers in front of me.
Age breakdown. So it is for 2 and older.
No, I think more in terms of like cases in the 2 to 5 year age group.
Yeah.
I mean, the current CDC guidelines and American Academy of Pediatrics, I think it's 2 and over. So I think that's why we came up with that.
I'll give Jenna a moment to see if she can find that.
I have to run reports, so it might take a moment if you want to
Okay.
continue the discussion.
Yep. So I think that, it is important that we're looking at this data, that we keep following it. It's, obviously an issue that I think everyone has their stance on, and hopefully everyone can understand that the need to be flexible in terms of adjusting where one is at any given time, depending on the data. And so I think that our board has demonstrated that we have that flexibility, where we've kind of all at some points been in favor of the mask mandate, and at some points all of us have been in favor of not having a mask mandate. And just at the edges of when things are slightly better or slightly worse, I think that's where we get into this realm where we start to have split decisions.
I think on that point, Nathan, I mean, the reality is that we're not having a particularly significant debate over the numbers. It's really, how do you make judgments based on numbers we all agree on, and different people, reasonable people, reach different conclusions. And I think that's, the place where we're at. Yeah.
I was a little disheartened in some of the emails that I had read where, people, back to the kind of public trust, people that were basically thumbing their nose at the Board of Health and saying that, regardless of what you say, I'm going to go out and do, whatever I want. I think that is counterproductive. I think that we're all weary and tired of the pandemic and wish that it would end. But just wanting it to end won't end the pandemic. And so that's something that we're all wrestling with. And I don't want people to think that the Board of Health is, completely out of tune to what, people are experiencing. I think that's important to be said. Let's see, it looks like Jennifer might have some.
There have been 11 2 and under since January 1st.
Sorry, in the 2 to 5 range. So I think that was what Alan was asking about in terms of
2 to 5. Okay.
Yeah, in terms of whether we wanted to change the mask mandate so that it does not include the 2 to 5 year old age group.
2 to 5. Sorry. All right. I'll give you a moment. Give me a moment.
That's right. Because I think that, narrowing the restrictions, if it turns out that that is, less of a risk, then we can certainly, talk about that. I do wonder how many people will change their actions when we switch from a mandate to a recommendation. There are obviously people that are doing what they want anyway right now, a very small group, but the number of people that will stop wearing masks in, let's say, public indoor spaces will increase if we switch from a mandate to a recommendation. And obviously, if we switch to no longer being, required, no longer being recommended, I think, it'll drop even further. And so on that continuum, I'm not sure exactly how much that's going to introduce. Obviously, if it was a very negligible amount, I'd be much more comfortable removing the mandate. But it's really hard for me to judge, what the effect of our decision is. I know that other government groups that are really worried about, people's response, like the Fed, when they're talking about, raising interest rates, just them talking about considering it is enough to have people change their course of action. And so I think that us debating, what to do next could have that same effect, but I really would like to get it to the point where people realize that this is still here. COVID, it's still causing hospitalizations, it's still causing sickness. And even over and above the hospitalizations, there are lots of people that end up much worse than just a flu, where they are, exhausted, can't get out of bed for like a week. And so they might not go to the hospital, but they're still experiencing symptoms and, and fairly large symptoms. So there's no perfect number to follow, but, when we look at the, somewhere in between being diagnosed and being hospitalized, I think is, where we need to be focusing. So we'll give Jen a little bit longer.
And another issue with the numbers is a lot of people are also doing rapid tests at home that aren't getting reported. So we really have to think that the number of the 174 cases in the past week is much higher. Our schools are doing rapid tests in the schools, and not all of those have been added into that number. So the number is still high. I agree with you, and I am hoping, they continue to decrease. But to the 14-day incidence rate as of last Friday for Westborough per mass.gov was 216, which with the 19.7 test positivity, and both of these numbers, like I had mentioned before, are still very high in the very high transmission range. We definitely want to see that come down quite a bit more.
It would be 16 children from that age group.
What's that time frame, Jen?
January.
Yeah, I could probably go either way on whether we wanted to include the 2 to 5 year olds in the mandate. I know that even the governments are split on that in terms of the World Health Organization. I think consistently here in the US, the CDC and the pediatrics group, Dr. Mayer was saying, both are in favor of keeping the 2 to 5 wearing masks.
Can I also tell you that once we have been receiving phone calls from parents with concerns of their 2-year-olds wearing masks, and that they would like to see that removed at their daycares. So I do refer them to their pediatrician because if they're capable of wearing one or not, the pediatrician will say so. So that's been helping as well.
What are your thoughts, Dr. Mayer, on?
Well, we don't. Yeah, our decisions don't. The daycare centers have their own rules and guidelines that they're going by for the state. That isn't necessarily from us, correct?
The EEC, which mirrors our guidelines.
Okay.
Mirrors our current guidelines, you're saying.
Mm-hmm.
But if someone were to take their child out to a grocery store, that would be something that's not covered by EEC, but would be covered by our current mandate. And so the question is a 2 to 5 year old that's presumably with a parent in a public space, how important is it for us to require that they're wearing a mask? And again,
I don't. Right.
Go ahead. No.
I don't see that we need to change that. I think following the CDC guidelines and the American Academy of Pediatrics guidelines is what makes the most sense, which is what we've been doing.
Okay, well, if there's not more discussion, I think that it doesn't sound like we're in favor of amending the current guidelines to exclude the 2 to 5 year olds. Dr. Ehrlich, if you'd like to make a motion on it, we can go through the motion. But otherwise, maybe we'll just go toward a motion to extend the mandate, and we need to kind of put a date on when we'd like to have our next meeting and when we'd like to have this in force for, as far as a motion. Dr. Mayer, would you like to make the motion, or do you want me?
Sure. Make a motion that we extend the mask mandate another week and revisit. Sorry, looking at my calendar.
I think that we had decided that
February.
Tuesdays are nice because we could,
Right.
use the fact that our employees are here a little bit later.
So February 8th.
What do you
So
think,
I'm sorry, could you
Dr.
just, did you say the 8th? Is that what you said, Melissa?
Yes, February 8th.
My schedule's fine for that.
Mine is as well. And so the motion then would be to have it in place until the end of the day on February 8th. And we could try to schedule our meeting for February 8th as well, so that we can review the data and see if it needs to be extended, again. If there's no other additions, we'll come to a vote.
I have something that is subsequent to this motion. So once this motion's over, I have another issue.
Okay. So with that, we'll take a roll call vote. Dr. Mayer,
Mayor, yes.
Dr. Ehrlich,
Ehrlich, no.
and Dr. Walsh, yes. So it's a split vote, and one that we will be revisiting in a week, and hopefully, the numbers in town will look significantly better next week. So Dr. Ehrlich, you said you had a second item that you'd like to bring up?
Yeah, pertinent to the general discussion. Right now we have an advisory, or I'm not sure what level it's at, regarding meetings in person. And I didn't know if we want to have any discussion about whether that needs to change.
No, I think that's a good point. I'm glad you brought that up. Yeah, I think that we had asked all meetings in town to go remote if they could. I think that I might still advise that meetings be remote, but I'm not sure that we need a mandate. And so I'm not sure. Jen, do you have the?
It wasn't a mandate, it was an advisory to meet remotely unless unable.
Okay. And so Dr. Ehrlich, you would like to think about either
I guess
rescinding that or talking about that, or maybe just changing it to like encourage rather than
encourage would be fine. I wanted to just have a quick discussion. I wanted to ask Jen whether there had been feedback from other boards or parts of groups that want to come together where there'd been some concerns about this, and just to see where things stood. That's mostly what I wanted to bring up.
I think you'll find a split. Some having it virtual makes it difficult, while others are trying to be supportive of the Board of Health, and others have to meet remotely. So you're finding a split.
Yeah, so I guess I would think that encouraging people to meet remotely in some situations makes sense. I can certainly imagine other situations where there's only a few people that are involved in the meeting, and the room size is sufficiently spacious that it's much less of a concern. Meeting duration probably also comes into play. So maybe as broad as our statement is, maybe it's overly broad at this time. But I don't know. If you've got better wordsmithing skills, Dr. Ehrlich, you want to propose something?
Either we just, I'm not sure that I do off the top of my head. And for another week, if we're going to meet in a week, maybe we just put this on the agenda for that meeting as well, and just see what the numbers look like. Again, people can meet in person, sounds like, if they need to, but for the moment, another week of remote meetings is probably fine.
Okay, so we'll put that on the agenda for next week. I did actually glance over at the chat, and one of the things that caught my eye is people that are talking about vaccine effectiveness. We haven't really mentioned vaccinations this meeting. I think that, again, everyone here on the board thinks that vaccinations are very important and very effective, not 100% effective, but very effective nonetheless. And that it all comes down to a layering approach of multiple different strategies, where if you don't have all of them in place, the more you have, the better off you are. But it's a process of trying to make sure that people are safe, and there's no one magic bullet that's going to solve all of our problems.
So I want to address the comment about vaccines being effective, because when you say they're effective, it's like, well, what do you mean by that? And so in general, when I say vaccines are effective, what I mean is they are effective at substantially reducing your risk of getting serious illness or being hospitalized or even dying from COVID. What's clear is that with Omicron, your risk of transmitting the disease may not be affected all that much by the vaccination. That there's high levels of transmission even amongst vaccinated people, but they're still much less likely than if they're not vaccinated to become seriously ill. The problem with Omicron is that even if you have a much smaller risk of getting seriously ill, when you apply that to a very large population, because so many more people get infected, you still get a lot of people getting seriously ill and needing to be hospitalized. So it is less virulent, meaning it's less likely to cause serious illness, but it's much more transmissible, meaning more people get affected. So, it's hard to weigh out the net effect. But I don't think anybody, Nathan or Melissa or myself, doubts that vaccines are a good idea. And we do think that they are effective. But again, it doesn't mean you will never get COVID if you get a vaccination. It doesn't mean you can't transmit it to other people. But it does greatly increase your likelihood of not having a severe illness. And if either of my board members wants to, comment on that, I'm happy for them to do so. But I think just because you see these comments about, what does it mean for the vaccine to be effective? How can I got the vaccine? How can I still get COVID? Okay. As perhaps originally our hope was the vaccines would prevent you from getting COVID, but at the very least, and this is actually not all that dissimilar to flu vaccine. You can still get the flu if you've had a flu vaccine, but if you do get it, you're less likely to have severe illness and require hospitalization.
Thank you, Dr. Ehrlich. I appreciate that. And I think the other general thought that people keep expressing is that if they've done one of the things that we're asking them, like get vaccinated, that means they never have to worry about taking any other precaution at all ever. And that's just not how it works. And if you are telling your kids or your friends or somebody else that all you have to do is get vaccinated, once you get vaccinated, everything's going to be back to normal, that's misleading. So don't tell people that. It helps. It's part of the process, but there are other things like, social distancing and, interacting with people in a very close setting where even if you were vaccinated, as Dr. Ehrlich said, you can transmit the virus. And there's a certain percentage of time when someone gets the virus, they will end up hospitalized. So vaccines are important, but they're not the only strategy. And so often people are writing in and saying, well, I got vaccinated, so now why do I have to wear a mask? Or my kid finally agreed to get vaccinated, and so now they're vaccinated and they're still wondering why they have to wear a mask. And so they're not, it's not an either or. When your doctor tells you to stop drinking, stop smoking, eat well, and exercise and get a good night's sleep to stay healthy. If you come back and say that, you're sleeping well so that you can keep smoking and drinking and, not exercising, that's just not how it works. There are layers of protection, and the more of those you do, the better you will, better off you will be health outcome wise. So I do want to just make sure that people really understand that it's not a one or none. These are not, if I've done one thing, I don't have to do anything else. I don't know if either of you have more comments on that, but I kind of just wanted to make sure that got said.
No, vaccination is very important, and agree. It is one layer of protection, but it is very important. And still, we're trying to encourage people to get their booster. Booster is really important, Omicron, and vaccinate children. I know that percentage of kids vaccinated in town, the younger kids, is not as high as older. I'm hoping that continues to go up. I don't know if we're having another vaccination clinic. I'm not sure if anything's planned. Jen, can't hear you. Sorry.
We have nothing planned at the moment.
Okay, so with that, I think that we've got our next agenda meeting will be on the 8th. We have the discussion about the mandate that we want to stay in effect. We voted on that. Is there anything else that we need to cover today?
I just wanted to make one comment, because we don't talk about this in the weekly report specifically. It's only been recently coming out, and this has to do with something that was in the chat about the incidental COVID. So when someone gets admitted to the hospital, often they're being tested for COVID, regardless of what they're being admitted to the hospital for. Some have COVID and they're being hospitalized for another reason, or at least that's what we believe. And sometimes they're being hospitalized specifically because of COVID and the effects of COVID. The fact that some people are being hospitalized with COVID, not because of COVID, doesn't alter the fact that there's still a lot of hospitalizations due to COVID. If you look at the report, maybe even if it's half and half, you still have over 1,000 people in the hospital right now, specifically because of COVID. And I just wanted to, the problem that we're facing as a board and as a community at large is we have to make decisions with imperfect data. We don't have the luxury of having randomized controlled trials that take months or years to conduct. We don't, if they're not there, we can't say, well, therefore we won't make any decision, because we don't know what the best decision might be if we had perfect information. So there's a lot of different perspectives. People people will point to data points that they think are most relevant, but there isn't a single source where we can go to and say, here's how we decide what's most important. Those are value judgments, and different people see it differently.
One thing I did want to mention is that multiple pharmacies, including CVS, I think Walgreens, I'm sorry, I know there's a few others, will be supplying people with N95s starting, I think, this week, free to the public from the government. So I think it's worth mentioning since we're talking about masks. But
the issue with the N95s is there's a limited number, and unless you're able to get sort of replacements on a semi-regular basis, it's a sort of a stopgap measure. But if you get it, I'm in favor of it too.
I'm sorry, what did you mean by that, Alan?
What I mean is, if you get an N95 mask, you can't wear it for a month. Its effectiveness and its need for maintenance and whatnot, it has a limited lifespan. And so unless you're able to constantly renew, that's what I'm saying. It's a stopgap measure. And maybe right now is the moment when we need stopgap measures. Okay, that's a good idea, but it's not a permanent solution is all I'm saying.
With that, is there a motion to adjourn?
I'll move to adjourn.
I second the
Dr.
motion.
Ehrlich? Oh, sorry. Thank you, Dr. Mayer. Dr. Ehrlich?
Ehrlich, yes.
Dr. Mayer?
Mayor, yes.
Dr. Walsh, yes. Want to thank everybody in town for staying late and getting this meeting done. And next meeting will be on Tuesday of next week.
Thank you.
Thank you.
Thank you, everyone.